Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, May the 12th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and the General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. May I begin by saying that there are two groups that are in very good company with one another this week because it is both National Nursing Week, which we spoke about on Monday, and it is also National Police Week. And we spoke about the courage of our nursing people, nursing professionals in the province and in the city on Monday, and today I think we can salute equally the courage and the service of our police officers, the women and men who serve us each and every day under the leadership of Chief Ryder and do a good job keeping the city safe and at the same time working hard on finding opportunities to modernize policing in the City of Toronto and be a leader in that regard. May I also say at the outset a happy Eid Mubarak to our friends in the Muslim faith community. This is a very important event on their calendar each year, and unfortunately, like many things, they'll have to celebrate differently and safely. But nonetheless, they will be celebrating, and we join them in marking Eid as a very important occasion on the calendar. Team Toronto has now distributed more than 1.5 million doses of COVID-19 vaccine in the City of Toronto, the first city in Canada to reach that threshold. On behalf of all of the residents of the City of Toronto, I want to thank our hospital, our healthcare, and our community partners, along with all of the Toronto Public Health and city staff who've made that happen. They've been working really hard in many different respects to get people vaccinated in the City of Toronto. It is amazing to see the city's dashboard on vaccinations with higher and higher percentages of age groups being vaccinated as the province opens up eligibility and as vaccine supply has increased. More than 70% of adults 80 plus, for example, have been vaccinated. More than 75% of adults between 70 and 79 have been vaccinated. More than 71% of adults between the ages of 60 and 69. And 61% of adults between the ages of 55 and 59 have received their shot, while almost 53% of adults between 50 and 54 have been vaccinated. Even in the younger age groups, we are seeing the percentages climb, with 43% of people 40 plus and even 36% of people between the ages of 20 and 24 have been vaccinated. This is good work. Now we just have to keep going with the cooperation from the other governments until everyone who wants their shot is able to get it. But we have the capacity, we have solid momentum, and we're targeting places where we can do the most good. So supply willing, we will move forward and get this job done. Further to that, as of tomorrow, more people in our city will be eligible to get vaccinated at city-run clinics when the province opens up registration to people 40 plus across the city, not just residents who live in hotspot postal codes. To help prepare for increased demand created by this change in eligibility from the province, the city has worked to be able to open up 5,000 new appointments, additional vaccine appointments, for next week. As the province takes decisions to expand eligibility, we will expect their cooperation to put us in a position to be able to expand vaccination capacity accordingly. As you know, we only open up appointments to match vaccine doses that we have on hand or know we will have in the coming weeks. And the more vaccine supply we can receive as a city, the more capacity we can open up in our clinics, both the city-run clinics and in the clinics that are operated on a hotspot and other targeted basis across the city. We are also announcing today that we are again expanding our sprint strategy that focuses on the hottest of hotspots in the city to include 5 additional postal codes, including 3 more in Scarborough. This will ensure more than 100,000 vaccine doses will be available for mobile and pop-up clinics in 22 of our hottest hotspot postal codes. That's up from an initial number of 13. The sprint strategy is working, and it is making a difference. We are seeing double-digit percentage increases in vaccination rates in the areas where we focused, and I'm going to give you a couple of examples. Across the first 13 priority postal codes, we have seen the average of people 18 plus in age vaccinated go from 13.8% in early April to 48.6% by last Sunday, May the 9th. In the 4 postal codes we added last week, just last week, The average has climbed from 17.5% when we began the sprint exercise on April the 5th to 51.6% this week. So I want to say thank you to everyone involved in the sprint strategy for the work that you have done and the work that I know you will continue to do to get people vaccinated in the areas where we know that COVID-19 is having its worst impact. And I want to say thank you as well to the people who've come out to get vaccinated. With a lot of help from a lot of hard work on the part of community organizations and people that are trusted in those neighborhoods, the people, you out there who we serve, have responded. And you've been vaccinated, but there's still obviously work to be done if we're just over half, but that's significant progress in a very short period of time. The strategy is making sure that we get vaccines in the right arms right now. I also want to provide an update on the extraordinary work that is happening at the community level to support widespread access to COVID-19 vaccination. We have a very strong partnership, which the city has wholeheartedly supported, between our health partners, community agencies, and city staff. And this has resulted in some powerful programs that have been well received by communities across the city. It is no different than what I said about the transit announcements that have come our way in the last 2 days. When people work together, governments, community agencies, health partners, city staff, great things can be accomplished. We've worked together to listen to and respond to specific community needs and to help people get vaccinated. When we rolled out our vaccination program for the city, we invested in programs to ensure increased equity so that everyone has an opportunity to get the protection of a vaccination as soon as possible and as easily and accessibly as possible. I'm proud to share some of the initiatives that we've launched under our community engagement and mobilization plan. This includes communities that experience high rates of infection, that face systemic racism, that face accessibility and other barriers, and we have engaged with groups that have a trusted role in those communities to support this work. Some examples of our equity initiatives include the Black Scientist Task Force, which includes many of Canada's top Black scientists, and it has been working in partnership with the Taibu Community Health Centre to address Black community concerns and issues related to COVID-19 virus, testing, and vaccinations. More than 6,500 residents attended these vaccine information sessions put on by the Black Scientist Task Force, and surveys of attendees indicated a positive change, a marked positive change, in the intention to get vaccinated after the seminar was held. The Accessibility Task Force was instrumental in making sure we achieved a 100% completion rate for the vaccination of people with developmental disabilities in congregate settings. And together with that task force, we are holding dedicated vaccination clinics for adults with disabilities this week and next. And for those clinics, all 1,200 appointments have been booked. The clinics will themselves be fully accessible and have on-site accessibility coordinators to provide assistance if needed. Our vaccine engagement teamwork is also continuing. 155 community agencies are hiring 280 community ambassadors who will reach out directly to more than 68,000 residents and support them in addressing any barriers they may face in getting vaccinated. So far, 1,075 nonprofit sector representatives have been engaged in workshops, in training, and in information sessions to prepare for community outreach and support in 140 different neighborhoods. This is work that will pay off in the long term, and it will make sure that we reach out to everyone in our city so that everyone is encouraged and helped to get vaccinated. Community efforts to support residents are evident everywhere across the city. Just this past weekend, as a great example, the Jamaican Canadian Association hosted a clinic to serve the Black, Caribbean, and African community. People in those communities have been disproportionately affected by COVID-19. There was music, food, information, and most important of all, 2,231 doses of vaccine were administered to members of this community hit so hard by COVID-19. So again, I want to express my heartfelt appreciation as mayor to all of our health partners, to all of the community groups who have responded with such a big heart to working with the city to improve the health of our residents through the community engagement and mobilization plan. There is much more work to be done, but I wanted to give an update on this work today to highlight not just the efforts that are underway, but the success that it's achieving in increasing those rates of vaccination in those communities where they were so low not that long ago. Now I would like to ask Dr. de Villa to give her update for today.
Thank you, Mayor Tory, and good afternoon. On Monday, I had the opportunity to offer greetings and well wishes to my nursing colleagues to mark Nursing Week. Like Mayor Tory, today I send greetings to colleagues in police services, as it is also Police Week this week. To my colleagues in the police services, my sincere and heartfelt thanks for your service. Today, I am reporting 814 new cases of COVID-19. 1,081 people are in hospital. 265 people are in the ICU. And I'm saddened to report 20 deaths today. As you've just heard from the Mayor, there is increasing momentum in the vaccination campaign. And this is welcome news for all of us. Just a few hours ago, the province said that almost 4 million doses of vaccine will be delivered over the month of May, and that details are being finalized to expand vaccine access to children and teenagers between the ages of 12 and 17. We at Toronto Public Health are looking forward to receiving these details and ultimately to working with the relevant partners to get this done. On the ground in Toronto, we will see the expansion of neighborhoods which will have pop-up and mobile vaccine clinics. This approach has been enormously successful in facilitating vaccine delivery. Neighborhood enthusiasm for the pop-up and mobile clinics reflects this. In our excitement and in our understandable tendency to count needles in arms, we may forget that our shared goal, our real goal, is this: the health outcomes of vaccination. People protected from severe and life-threatening illness and reduced spread of COVID-19 amongst those yet to be vaccinated. As with so many aspects of the pandemic, the pop-up and mobile clinics have emerged unexpectedly as a real success story. And I want to thank the people who've helped to make this happen. Our hospital partners, the Ontario health teams, and in particular, the community leaders and organizations that have been so effective at reaching out to the communities and especially at communicating with them to encourage vaccine uptake and to address hesitancy. We all hoped for vaccines for most of the pandemic, especially when all we had was hope. We all felt a sense of confidence in the idea of COVID-19 vaccines because the concept of vaccination is familiar and regular to most of us. It was care, testing, study, and analysis that made the vaccines possible and produced them for our protection from COVID-19. And it is care, testing, study, and analysis that will continue to determine the path forward. I will close today asking you to remember the most important thing. Science and study prove the risks from COVID-19 infection are significant, as severe as hospitalization and death, and for those who recover from the worst of it, lingering and sometimes debilitating symptoms. Science and study also prove that COVID-19 vaccines provide safe and effective protection from that threat. Stay confident, stay informed, and be ready to take your turn as more and more vaccine becomes available. We are not long now from seeing how the protection the vaccines provide begins to meaningfully turn the tide in our favor. With that, I'll now hand it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa, and good afternoon. Before I begin my formal remarks this afternoon, I too would like to acknowledge that this is National Police Week. This year's theme is working together to keep our communities safe. Each and every day, our Toronto police officers are on the very front lines of community safety, working to keep Toronto safe. The challenges of protecting public health and safety in a city as large and dynamic as Toronto are very significant. Fulfilling this mandate during the COVID-19 pandemic is all the more challenging. I would like to extend my sincere thanks to Chief Raymer and to each of my Toronto police colleagues who work day and night to keep us all safe. The eligibility for booking vaccine appointments is determined by the Province of Ontario. On Tuesday morning this week, the province extended vaccine eligibility to all individuals with at-risk health conditions such as dementia and diabetes, as well as to Group 2 of people who cannot work from home, including grocery store, restaurant, and transportation workers. Since Tuesday morning, more than 15,000 people have successfully booked their appointments to receive COVID-19 vaccine in a city-operated clinic. Of course, our ability to make vaccine appointments available and to administer vaccine in city-operated clinics is dependent upon the supply of vaccine that is available to us. As of this morning, while our city-operated clinics are very close to being fully booked for a number of weeks, there are still appointment times remaining available between today and June 13. For the remainder of this week, our clinics are 98% booked, with approximately 1,200 appointment slots remaining available to be booked as of this morning. For the week of May 17, our clinics are nearly fully booked, although I'm pleased that we will be making an additional 5,000 appointments available for the week of May 17. These additional appointments will go live in the booking system at 8 a.m. tomorrow morning. For the week of May 24, our clinics are nearly fully booked. For the week of May 31, our clinics are 97% booked. And for the week of June 7th, approximately 23,000 appointments remain available to be booked. Tomorrow at 8 a.m., the Province of Ontario will expand vaccine eligibility at city-run clinics to anyone who is 40 years of age or older. We are working to open new blocks of appointments on a proactive basis and as very soon as possible, in an effort to ensure that people have as much opportunity as possible to book their vaccine appointments. Over the course of this week, our clinics are operating at the highest weekly vaccine administration rates yet, with 98,280 people being able to be vaccinated across our network of 9 city-operated clinics this week. The number of appointments that are made available corresponds directly with the number of doses of vaccine that are provided to us. As additional vaccine is provided to the city by the Province of Ontario, we have plans in place to expand our city-operated clinic operations to match. Between the 1st and 10th of May, we have averaged a 1.7% no-show rate across the network of 9 city-operated clinics. This means that, on average, approximately 1.7% of people who have a confirmed appointment in a city-operated clinic did not arrive for their confirmed appointment. While we have robust processes in place to ensure that the associated doses of vaccine do not go to waste when this happens, this does result in valuable appointments not being used when they are available. I ask everyone who has booked a vaccine appointment to be sure to cancel in advance in the event you are unable to make your scheduled appointment. This will ensure that the maximum number of people are able to receive their COVID-19 vaccine as very quickly as possible. Appointments can be canceled via the online booking system or by calling the provincial call center. Thank you for all that you do to help stop the spread of COVID-19 in our city, and please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you.
Thank you very much, Chief. We'll now go to questions. Just a reminder to please unmute yourself, and we'll go first to John Woodward from CTV News. John, go ahead, please.
Hey there. This is a story, there's been quite a bit of talk about gyms today. This is a question, I suppose, about underground gyms. How widespread is a phenomenon where someone would rent a private room and do physical activity there with a trainer? What are the risks there, and how many enforcement actions, for example, have you done on that in the city?
I'll certainly start. To be very candid, that's not a circumstance that has hit my radar of late. I will say that as we have seen throughout COVID-19, when complaints are received by the city, generally via 311, they are received, they are triaged based on priority, assigned a priority based on the risk that's identified in the complaint, and then our coordinated enforcement teams comprised of Toronto Public Health, Municipal Licensing and Standards, and Toronto Police will respond to those complaints. Unfortunately, I don't have data relating to enforcement or specific data relating to enforcement on gyms. Brad, I'm not sure if we have enforcement services on the line.
Carlton Grant is on the line. Carlton, do you have any update on that, please?
Sure, and thank you for the question. We've had minimal number of complaints about gyms, outdoor gyms, underground gyms, real gyms operating. We have dealt with them, and the one that came to our attention this morning on Richmond Street is currently under investigation for a number of matters, and we will continue to follow up with our investigation. But this is a very small sample size of complaints and issues that we have related to gyms.
And maybe this is for the medical health officer, what is the risk right now for gyms and underground gyms? And what should we be telling people who want to participate in indoor physical activity like that?
Well, I don't know that I can provide a numerical figure on what the exact risk is, but I can say in general that any kind of indoor activity, particularly without the use of masks and involving the interaction between people that don't live in the same household, presents a risk for COVID-19 transmission. That's something we've talked about for many, many months now, as our understanding of COVID-19 and how it transmits from one person to another has grown over the course of this pandemic. As we heard from Chief Pegg and from Carlton Grant, thankfully this seems to be something that is relatively infrequent, and I would encourage people to take advantage of the nice weather that we have, to absolutely get some physical activity, both for their own mental and physical health, but to do so in an outdoors environment where in fact the risk of COVID-19 transmission is significantly reduced, just given the big airspace and I guess what you could call a really good ventilation, because you're in that big broad airspace. So there's lots of opportunities as weather improves for people to get that physical activity and to do that for their own mental and physical health in that safer environment as we work to get to the other side of this pandemic.
Okay, thank you. We'll go next to David Ryder from the Toronto Star. Dave, go ahead, please.
Hi there. First question about the vaccination rollout, and that's the Health Board on Monday urged the Ontario government to extend the allocation of 50% of vaccine to hotspots for another 2 weeks. I believe, somebody can correct me if I'm wrong, I think it's going to end on the 17th. My question is, I guess, two parts. And one is, how, if it's not extended, how does that change the balance of vaccine in Toronto as far as city clinics versus the mobile and pop-ups that we have heard have done such good work? And also, is there any update on how many vaccines we're getting on what dates?
So David, why don't I start off? We'll see if anybody else has anything they'd like to add to the answer. I don't have the specific numbers in front of me, but clearly, we have been buoyed by the progress that we've seen in the vaccination rollout. You've heard the mayor mention them in his remarks today. I spoke about the success that we're having in those mobile and pop-up clinics, and we're seeing real interest, real uptake of vaccine in some of these hardest hit neighborhoods in our city. So, I'm really hopeful that we'll be able to continue our work with our provincial counterparts. These discussions happen all the time. We recognize that, there are supply issues and there are always challenges. But it's my sincere hope that we're able to have constructive dialogue with our provincial counterparts, recognizing that really putting the resources in those hotspot communities actually not only benefits those communities directly and benefits the whole City of Toronto, but frankly is a big benefit for the entire province of Ontario ultimately.
Thanks. Can Chief Pegg answer about the supply if we know when we're getting what?
Hi, Dave. With respect to the supply, knowing what is coming, I don't have anything more. I certainly don't have any visibility beyond what Dr. de Villa and the Toronto Public Health team does. With respect to the positive impact of that strategy, and I just did a bit of quick math. So as I noted in my remarks, this week in our clinics, we are delivering more than 90,000 doses of vaccine. And that, of course, is the direct result and directly correlated to the additional vaccine supply. When that ends and we return to the more normalized rate absent of that additional bolus, we would return to about 60,000 doses a week. So there's about between 30 and 40,000 dose differential happening in the clinics this week. With 98,000 doses being administered this week, that's fantastic. That's operating our clinics very close to their design throughput, which is fantastic to see. And I know all of us look forward to being in a position where we can maintain those weekly, maintain or exceed those weekly throughput or administration rates on a weekly basis going forward.
May I just add that, we have consistently been advocating, and again, all the GTHA mayors and chairs this week advocated for a continuation of extra supply being allocated to hotspots. It's working. The numbers that we've presented here today, again, indicate just how profoundly well it is working. We proceed on the premise that it is best to hit this virus hardest where it is hitting people the hardest, and that we can produce the results to justify that allocation of vaccine. And so we will continue to advocate for that, as we have done for some time now. And as I say, it was of interest to me that in the whole region, people in elected offices accepted the fact that the region should be treated in that respect, which is to have extra vaccine, recognizing the particular challenges that exist in this part of the province. And it will have benefits province-wide. What heals people and stops the spread of this virus and makes people healthier in the City of Toronto and in the Toronto region will be good for all of Ontario.
Follow-up, Dave?
Yeah, my follow-up is, I think, for Dr. de Villa, and that's this morning the Ontario government said that it does not plan to require students to be vaccinated to go back to school, although there obviously is going to be a campaign to get as many kids vaccinated as possible. I'm wondering if you have any comment on what that means for the safety of school, given that there are a host of things for which most students have to get vaccinated now for measles, et cetera, unless they have very specific exemptions.
So, David, for now, we're just hearing ourselves of, the fact that there is this expansion of vaccine access that is meant to include children and teenagers between the ages of 12 and 17. So I don't know that I have much more by way of detail to speak on that. I would say this, like most other services within healthcare, we do expect that there will be informed consent as part of that. And, my sense is that we've seen our community really take up vaccine very well because they're actually seeing the benefits of vaccination, both for themselves as individuals, but more broadly as a community. So it's my sincere hope that we'll see that extend to younger people as they are now eligible or soon to be eligible to receive vaccine. And my sincere hope is that we will see families supporting the young people in their lives getting access to vaccine for its protective benefit. It is truly protecting people, not just here, but all over the world, from severe illness and life-threatening illness, wherever it's being administered. So I really do hope that people will appreciate that and really seek out the benefit of the protection of vaccines for themselves and for their children.
Okay, thank you. We'll go next to Samantha Beatty from CBC News. Samantha?
Hi. My question, I think, is for Dr. de Villa. So how is the city going to ensure that people who got their first dose at a mobile or pop-up clinic knows how and when to get their second dose? Will there be a coordinated strategy with all healthcare partners, and when will this be happening?
Yeah, so Samantha, thank you. This is, an important question, and one which is the subject of active discussion amongst all the partners, the healthcare partners and health system partners that are partaking in the vaccination campaign. As part of the vaccination campaign, all the vaccines that are being administered, regardless of which channel is being used, so this does include mobile and pop-up, data are being entered into the provincial COVAX system. Effectively an information technology database, if you will, a computer database. So we actually have the information on who's received that first dose of vaccine, what vaccine it is, and when. It's kind of like a medical record. So we actually have the information on those individuals so we can call them or connect with them and make sure that they are aware of when they should receive that second dose of vaccine. Again, lots of details still very much under active discussions, but I think you can rest assured that the healthcare partners and the health system partners who engaged in the vaccine efforts are committed to making sure that all those who've received that first dose of vaccine are offered that opportunity and facilitated in terms of getting that second dose of vaccine, because that's really what we want to see, that full protective benefit of vaccine being provided to everyone.
Okay, great. And my next question is that Toronto Public Health has a team that is tracking adverse events following immunization. What can you share about this, about what you've learned so far? And were any of Ontario's reported cases of blood clots linked to the AstraZeneca vaccine in Toronto?
So Samantha, there is a team absolutely that is working on adverse events following immunization. This is not unique to COVID-19 vaccines. We actually have a team of people who do this all year long. So my understanding is that the team is actively putting together reports where I don't know that I have anything specific to share with you today, but as their reports are being compiled and are ready for public dissemination, I'll be sure to share those details with you as soon as I can. Again, this is evidence of the work that public health does in the background each and every day, regardless of whether we're talking about COVID-19 vaccines or any other immunization that's out there. We have a team of professionals who work as part of that broader safety system, that vaccine surveillance and safety system, to ensure that people are truly experiencing the benefits of vaccine and that we're aware of any safety issues should they come, should they develop in follow-up to any vaccine, including the COVID-19 vaccines.
Thank you, Doctor. We'll go next to Nick Boisvert from CBC News. Nick?
Hi, Dr. de Villa. Your counterpart in Ottawa, Dr. Etches, just said today that she thinks it's looking positive for on the prospect of schools potentially reopening at the end of this month. Can you envision a roadmap, a scenario where Toronto could be in the same situation before the end of this school year?
You know, Nick, I'm not familiar with what the specifics are of the situation in Ottawa. I would say, though, that I believe our COVID-19 case rates and COVID-19 activity in the City of Toronto is generally higher than it has been, certainly over the past several weeks, when in comparison to Ottawa. So I did mention, though, as well, earlier this week, that I would like nothing more than to see our children back in in-person learning, because there are lots of benefits associated with that. But that should only happen in conditions where we can ensure that it is appropriate for them to go back, and where we know it's not only safe for those who are part of the school community, but frankly, safer for our entire community. So we're constantly watching and monitoring our indicators, monitoring COVID-19 activity in our community, and certainly are very interested in seeing children getting back to in-person learning as soon as it's possible and as soon as it's safe to do so, simply because we know there are so many benefits to be conferred upon children from that in-person learning. It's just, there are, I think, lots of very heroic efforts currently going on to ensure that there is ongoing instruction remotely, but we know that there are lots of benefits that just simply don't happen in quite the same way as they do in in-person learning environments.
Okay, thanks. And a follow-up on that, if I can, to Mayor Tory. Mayor, how would you like to see the communication sort of work to parents, say at the TDSB, about when a decision might be made that the school year is perhaps not going to come back in person, or that it's still open, so that maybe parents aren't so sort of left hanging as they might be right now about whether their kids are going to go back or not?
Well, I just think the important thing is that there be a decision and that it be communicated to parents as soon as possible, recognizing that all of this is, even though it's science, it's an imprecise science in the context of how fast things will change for the better and how soon it will be safe. But we've said before, all the mayors said earlier this week from across this region, and I certainly would say as the Mayor of Toronto that, and I know the province is working hard on having some news for us fairly soon, but I think they should have that news as soon as possible, make it as clear as possible so that people can make their plans, and so that we can make sure that kids are as safe and healthy in whatever the circumstance as possible, because I think in the end that's what we mostly want, is to make sure that the kids are safe and healthy at whatever determination is made as to what should happen with their schooling, and it may well be some other result in between, schools being sort of totally open or totally closed. I don't know.
Okay, thank you. Final question today is from Beth McDonnell from CTV News. Go ahead, Beth.
Hi, this question is from Mayor Tory. Is the local planning appeal tribunal's decision today on Rail Deck Park a big blow to the future of the park? And what does it mean moving forward for the city's efforts to make it a reality?
Well, I respect the decision today, but I'm deeply disappointed by it because it makes it more difficult in the context of both the expense and otherwise for that park to proceed as envisaged. The park was envisaged as something that was needed in the downtown of a great city. If people look 25 years from now at what was done in 2021 and years in and around where we are today, do you think they're likely to say, well, gee, they built 15 or 20 more condo buildings, or do you think they're likely to say that they left a dramatically ugly rail corridor in place, or would they be more likely to say that what made that city great and kept it among the most livable cities in the world was they built a great, globally admired, iconic park for all the people of Toronto and for people who come to visit here? I picked the park. And so I just think my determination to make this city more livable and to reflect the fact that we're very fast growing and must pay attention to the need for open space and parkland, as evidenced surely by what's gone on in the pandemic, my determination to continue on that path is absolute. And we will just have to examine the decision and see what it says about Rail Deck Park. But my determination to make sure the city is livable and has proper parkland in all parts of the city, including downtown, is absolute. And so we will go forward with this decision in hand and see what implications it has. But I just think that we have to focus on why we're in the top 10 most livable cities in the world. I believe my job as mayor with my council colleagues is to make sure we stay on that list going forward. And if you look forward 25 years or less, one of the things we're going to have to do is a better job of making sure we have parkland and open space in all parts of the city, but including in downtown Toronto, where we're presently deficient in that regard. So it's very disappointing.
The tribunal talked about some of the city's arguments that were exaggerated and that the city could have purchased some of the rights for the site a long time ago. Do you think the city pursued the right strategy to get that space? And if so, why? Why not?
Well, a commercial negotiation is what it is. And I can just tell you, without getting into the details of the negotiations that took place, that the prices that were being asked for these air rights were not prices we were prepared to pay at that time. And so, you know, we are where we are. And the bottom line is that I had a dream, I'll call it that, of something that is, I think you have to think big in the context of building a great global city. And that's what that was about. And so we'll see where this one goes, but at the bottom line, as I've said, my determination to make sure that we dream big and that we do things that are going to make sure this stays the livable city that it must stay for the sake of the people who live here and for our global reputation, my determination on that is absolute. And so, you know, there are always bumps along the road, and you just move forward and try to do something that is going to make sure that we achieve that objective. And you can go back and analyze the discussions that took place in the past all you want, and the positions that people take, including, you know, the interest that people do or don't have in the well-being of the city as a whole. And but I don't consume myself with that.
All right, thank you, Mayor, and thank you all for joining us. That concludes today's briefing. Our next scheduled update will be this Monday, May the 17th. Please stay safe.